One of the big questions patients have is what do they leave with the day of surgery? And that's where the education component of this whole entire process is critical because they have to understand that the choices they make for the restoration that we choose to do completely dictates how that day one procedure goes. So if it's a removable procedure, where the restoration is going to be something that's a patient can take in and out, that dictates that the day of surgery, they generally leave with something removable. However, when it's fixed, one of these full arch restorations, teeth in a day concepts, what happens is we convert an existing restoration that's acrylic or resin in nature, and we engage it to the implants that we place on the day of surgery. So generally teeth are removed, implants are placed, and that restoration is then screw retained or fixed into the implants. Now we consider that restoration a temporary restoration. So we allow that restoration to stay in place for 4 to 6 months. And what dictates whether it's 4 or 6 months is the amount of healing that needs to occur. After that point, we always take another impression and create a final restoration. And that's where the decision comes whether or not the restoration is going to be a resin and acrylic-based restoration, or is it going to be a zirconium and ceramic-based restoration. The difference between the two is very similar to resin and plastic and glass and ceramic. So that there's a cost difference, but for the patient, they're both fixed. And so it's a patient's choice and decision on what they're looking for in that final restoration. But the reason it's critical to make a new restoration at that 4 to 6 month post-op appointment is because of the adaptation of the restoration to the healed gum tissue at that point. So that very first restoration that's placed the day of surgery, we consider that transitional or temporary, and we think it's really important for patients to understand that.